Now let's take a look at some of the ways that the brain functions a little differently in the case of depression, and we'll also be looking at bipolar, so manic phases as well. We're seeing that there are deficits in the size, so volume deficits, as well as in the activity of prefrontal areas, especially the dorsolateral prefrontal cortex. And remember, we also see a loss of tissue, loss of neurons in the hippocampus. But here we can see that the dorsolateral prefrontal cortex in unipolar depression and in bipolar depression is less active than in these control participants. We also see increased activity in the ventral prefrontal cortex. So while the dorsolateral prefrontal cortex is less active, there's actually more activity in this nearby area, the ventral prefrontal cortex. And this area is almost thought to be like a depression switch that seems to kick in when the depression comes on. In addition, there is increased activity in the amygdala, reflecting the greater stress and perhaps negative thoughts, as well as an increased volume or increased size of the amygdala as well. Brain activity during a manic episode increases by 4 to 36%. So here's an individual who on May 17th was not manic. So see here, very depressed activity, actually indicative of depression. In the middle here, we're seeing much more brain activity, and this is happening during a manic episode. And then once again, when the depression returns, the brain activity falls down, kind of decreases as well. So kind of what you would expect, right? That during the manic phase, there would be more brain activity than during depression. Now, remember, the ventral prefrontal cortex can be thought of as a depression switch. In addition, the subgenual prefrontal cortex may be a bipolar switch. Activity in these areas varies with the mood state in individuals with bipolar depression. And so we can see here the subgenual area, the prefrontal cortex, showing in the center here, in the very center where it's sort of black. We can see that there's decreased activity there during depression. And so in bipolar and unipolar depression, there is less activity there, but the activity increases during a manic phase. Suicide is certainly a factor in affective disorders. It is high among people who suffer from depression, but especially high among individuals with bipolar disorder, where 20% of individuals who are hospitalized with bipolar disorder may commit suicide. And we can see here the suicide rates for mood disorders, for alcoholism, schizophrenia, and the general population. Serotonin levels tend to be particularly low in individuals who do commit suicide. And in some cases, because SSRIs can make a person feel somewhat agitated, they are sometimes found to correlate with increased suicide rate in people who are depressed.